Again, these are all general introductory comments, and I'm sure you all fill your brains with techniques before the day is over. But I use 4 treatment models for all anxiety, including social anxiety. And those are the motivational model, the cognitive model, the exposure model, and the hidden emotion model. And within each of those models, I use many techniques. And they're all for important. And if you want an optimal outcome with a socially anxious patient or with someone with any form of anxiety, all 4 models will be helpful and, to my way of thinking, necessary. Now, the motivational model is all about therapeutic resistance. And in anxiety, there's 2 forms of resistance, and we'll talk more about them and how to deal with them. But there's what I call outcome resistance and process resistance. Outcome resistance means that the patient has ambivalent feelings about recovery. They want to get rid of their anxiety, but at the same time, they're afraid to get rid of their anxiety. And that's because on some level, in nearly all cases, the anxiety is protecting or helping the patient in one or in many ways. And in addition, the anxiety is nearly always the direct expression of the patient's core values as a human being. And if you ignore those resistance dimensions, it will impair your effectiveness with all anxious patients. That's outcome resistance. Now, process resistance is different. It means the patient may be yearning to get rid of their anxiety, but they don't want to engage in the process of therapy, something that they're going to have to do to get over their anxiety. And the thing that they're going to have to do with social anxiety is to use interpersonal exposure. Interpersonal exposure is not a single cure for social anxiety, just one technique among many, but it's necessary. For example, Jim, the fellow on the hike that I just described, once I got the A from him on empathy, we went on to the assessment of resistance. And I said, now, Jim, one of the things you're going to have to do if you want to be cured on today's hike is you're going to have to confront your fears and do some things that make you incredibly anxious. Are you willing to do that? And he said he would. And you may still have to push the patient. You may have to go out of the office with the patient and push them to do the thing that they've verbally agreed to. But I told him, okay, Jim, what I want you to do, we're going to meet a lot of people on the trail. And you said you've been, he was about 55 at least. And I said, you've been hiding your social anxiety from everybody since you were 5 years old. And that's why you feel ashamed. And the first thing I want you to do, every time we come to a hiker, coming from the opposite direction, I want you to go up to them and say, could I speak to you for a moment? And I want you to tell them that that you've been struggling with social anxiety your whole life, and you've been hiding it because you're extremely ashamed. And today you've decided to stop being ashamed, and so that's why I'm telling you that I'm socially anxious and I'm kind of nervous even at this very moment. And he was shocked that I told him he would have to do something like that. He said, "Oh, Dr. Burns, I couldn't possibly do that." I said, "Actually, you can do that, and you're going to do that. If you want to be cured today, if you want my help today, that's what you're going to have to do. And I'll help you with it, but I need the commitment to you that you'll do it, even though it's going to seem incredibly frightening at first." And so he was trembling, and he said, "I guess I'll do it then." And then we started hiking up this real steep trail, and a fellow came from the opposite direction. He looked like he might have been from India. And I said, tell this fellow, Jim. And Jim said, oh, no, I've changed my mind. I can't do it. And that's where you've got to be firm as a therapist. You've got to have that trust. And I said, no, you're going to do it. And I stopped the hiker. I said, can I stop you for a minute here? My colleague Jim has something he wants to tell you. And now he couldn't wriggle out from it. And he told this fellow, I want you to know, he says, this is going to sound ridiculous, but I've been shy and feel very uneasy in social situations, and I've been hiding it, and I've been ashamed of myself and feel kind of inferior because of that, and I've decided to stop being ashamed, and I'm going to start telling the whole world today, and that's why I'm telling you right now. And tears came to the eyes of this fellow. And he says, I can't believe what you're saying, because it's exactly the same with me. And I admire you so much. Would you mind if I joined your hike today? I'd really like to talk to you some more. So this fellow joined our hike, and he and Jim started talking, and they became best friends. And the fellow was saying, could we have dinner together sometime? And, you're one of the most amazing people I've ever met. And it was just a true high for him. And then he just started saying hello to every person that we met and said, hey, I want you to know I'm a real socially anxious guy. And he would say it laughing. He just completely overcame that fear. But that's the motivational model, is dealing with the resistance right up front. The cognitive model is, of course, based on the work of the Greek philosopher Epictetus, and also Albert Ellis and Aaron Beck, and so many cognitive therapists. And that's that all of our feelings, including social anxiety, comes from negative thoughts, messages we give ourselves, and that those thoughts are nearly always distorted. And when you change the way you think, when you stop believing those thoughts, you can change the way you feel. And you'll learn a lot of cognitive techniques for social anxiety. And then the exposure model is based on avoidance. The behavior therapists think that avoidance is the cause of all anxiety, and exposure is the cure for all anxiety. And there's a lot of truth to that, although it's not entirely true, but certainly exposure is important. And finally, the hidden emotion model is one that I've created, and it's based on the idea that all anxious patients are exceptionally nice, and the niceness is the actual cause of the anxiety. And what that means is that nearly 100% of anxious patients of any type of anxiety, including social anxiety, are exceptionally nice and tend to sweep negative feelings under the rug instead of sharing them with others. And it's that phenomenon that actually triggers the anxiety. But the problem that's upsetting the anxious patient is hidden from them. It's kind of at a subconscious level. They might be angry at their spouse or unhappy at work or whatever it may be. And I'll give you practical examples of this afternoon. But if they can bring those hidden feelings to conscious awareness and express them, you often see the anxiety suddenly disappear. And all of these models have tremendous healing power. And if you want the chance for a complete recovery with your patients, combining all four models is vastly better than just using one technique for social anxiety or any type of anxiety.